Hi, Dr. Yas here. Today we're going to discuss how to differentiate a rotator cuff strain from arthritis of the shoulder as the cause of shoulder pain. So many of you will end up having shoulder pain, go to a medical practitioner like an orthopedist, get an x-ray, find arthritis, and automatically be told that the cause of your shoulder pain is arthritis. The fear I have in this situation is that if it were arthritis, there's only one way to remove arthritis, and that's surgery. And so many of you would be hesitant to get surgery because of all the failures that have occurred and the understanding that it doesn't seem to be very successful. So you're going to be left with nothing more than the chances of getting some sort of oral medication or cortisone shots basically for the rest of your life. You'll also be limiting your ability to have any quality of life and improved or returned functional capacity because you're never really going to be addressing the cause of the symptoms. So in this premise of doing nothing more than masking your symptoms, you end up basically suffering and having a lack of quality of life that you're entitled to have simply because an improper diagnosis was given. So let's talk about the two types of issues, a rotator cuff strain, and we're separating or differentiating a strain from a tear. Forget the premise of a tear. When a tear is found on a diagnostic test like an MRI, it's always invalid unless you can show me that there was an immediate trauma shortly before you had your symptom, which would indicate that the rotator cuff tear is an actual acute tear and therefore is the cause of your symptoms. The vast majority, 98% of cases of people being told that they had a rotator cuff tear is actually a degenerative tear that has occurred over time. It has nothing to do with your symptoms. The tear will be there long after you have your symptoms resolved by utilizing a Yas method. It requires no intervention. We need to stop this premise that just because a structural variation is found, that somehow this means that structural variation requires some sort of intervention. You're living with these things 20, 30, 40 years. You have these things, and the only reason why they were identified is because you had pain associated with a muscle, which led to a diagnostic test which found the structural variation. They don't require intervention simply because they're identified. Let's end that premise. So let's talk about range of motion when it comes to the separation between a rotator cuff strain versus arthritis. So in both cases, I'm going to establish that if I try to raise my arm, right, I'm going to get pain. Oh, it hurts, and it limits my ability to raise my arm. The pain is limiting the ability. Now, let's talk about the difference in where you would expect to have your pain with a rotator cuff strain versus arthritis. Here's the clincher right here. So let's understand that the rotator cuff's purpose is to keep a space between the arm bone, the head of the arm bone, and the shoulder joint when raising the arm. When you raise the arm, we want to keep this space. The rotator cuff attaches below the head of the arm bone and actually pulls the head down as you're raising the arm, keeping this space here between the head of the arm bone and the shoulder bone. Okay? So when the rotator cuff strains, the arm bone actually comes up and impacts the shoulder bone, and as a result of that, limits the ability of this gliding that has to occur, and as a result, you find a limitation in raising your arm with pain. What aspect of shoulder motion is this most involved? The answer is from 80 degrees to 100 degrees. 80 degrees to 100 degrees. Once I get over 100 degrees, if you notice, my arm is pointing down, so gravity's pushing the head of the arm bone down. The rotator cuff is basically no longer involved. So somebody who has, I can't raise my arm, but then takes the arm, gets it over 100 degrees, and can raise it here pain-free, you have just proven that the cause of the symptom, the pain and the inability to raise your arm beyond shoulder height, is a strained rotator cuff. It has nothing to do with arthritis. Here's the difference. If it was arthritis, I could get through here, no problem, but right as I get up here, now it feels like I'm having horrible pain and I can't push. It feels like a bone is hitting another bone. So only at the very, very, very top range of motion of shoulder motion would I feel pain. And then when I try to push through the balance of it, it should feel like a bone is hitting another bone. That's the only time arthritis is presented in a physical presentation as being the cause of symptom. So just because you have shoulder pain and just because arthritis was found is a meaningless presentation. We want to look at the body. The whole premise of the Yas method is that the body is presenting physical signs as to what the cause is. It wants you to know whether it's muscle or bone because it wants the right intervention to resolve the distress of the tissue. So it's actually trying to identify that. So let's look again at range of motion. If it's the rotator cuff, oh, it hurts, I can't raise it up. I get it above 100 degrees because now I've taken the rotator cuff out and boom, I've got beautiful pain-free range of motion. I go below this again, oh, it hurts. I get it above it, bam, no problem. Arthritis, no problem. Oh, now it hurts at the very top of the range and it feels like a bone is hitting another bone. That's the difference. Understand that. Please give this to anybody who's having shoulder pain. Don't get caught with the immediate diagnosis of arthritis as the cause of your pain simply because it shows up on an x-ray. You have to appreciate that if that happens, barring surgery, which nobody's going to get unless it's an absolute last resort, which is the wrong reason to get it, especially if it's muscular in cause, you're going to be left with getting nothing more than cortisone shots, metryl dose packs, or some other form of medication, which is going to do nothing more than mask your symptom, and you will never be able to return to a full quality of function, which is what life's all about. If it's a rotator cuff strain, then a couple of targeted exercises, you resolve the cause of the symptoms, you have full range of motion, you're fully functional, and you have the quality of life back. Know the difference. The Yas method is the only method that is designed to interpret the body's presentation of symptoms along with some specific physical tests to determine what tissue is causing your pain. If it's muscle, which it is in 95 to 98% of cases, then simply doing targeted strength training is the answer to resolving your problem. The Yas method incorporates targeted strength training, the use of specific exercises for specific muscles using progressive resistance exercise, causing the muscles to adapt to greater and greater resistance, which is how a muscle gets stronger and then can function performing tasks without straining and eliciting pain. If you want more information, go to my website at www.mitchellyas.com or go and email me if you have questions. If you want information, further information, you want to find out about where to get my books, how to come to my office in St. Augustine, Florida, how to get a Skype evaluation, computer evaluation, just email me at drmitch@mitchellyas.com. That's Dr. Mitch at mitchellyas.com. Let's get the information. Let's help you resolve your pain. Let's help you get your life back. You deserve it. Unfortunately, right now, the Yas method is your only chance. Please contact me. Get the Yas method. Let's resolve your problems. Let's get your life back. This is Dr. Mitchell Yas wishing you a pain-free, fully functional life. Bye-bye.